Welcome to this week's public health seminar series out of the University of Montana School of Public and Community Health Sciences. We are very excited to have our speaker here today. Dr. Daniel Shattuck is from PIRE, and PIRE is the Pacific Institute for Research and Evaluation, and it's an independent nonprofit organization that's focused on merging scientific knowledge and research-based practices to create solutions that improve the health, safety, and well-being of individuals, communities, and nations around the world. And I'm sure you can tell I recited that from memory. I did it. I was reading it right off the website. So Dr. Shattuck is here today to talk to us about a couple needs assessments that were carried out with youth in New Mexico, and especially looking at how they've been impacted by housing insecurity and some other systemic harms. And we are just really grateful, Dr. Shattuck, to have you here with us. And with that, I will turn it over to you for your presentation.
Thanks for having me, everyone. I'm gonna see if I can successfully share my slides. Can you all see that? Great, okay. Oops. All right, so my name is Daniel Shattuck. I'm a research scientist at PIRE Southwest. And so today I just wanted to share with you all about two needs assessments that our team at PIRE conducted focused on youth and young people experiencing housing instability and homelessness in New Mexico. The needs assessments were a collaborative undertaking with the Child and Adolescent Services Research Center at the University of California, San Diego, and the University of New Mexico. And the work that I'll talk about today was really guided by a youth advisory council of young folks with lived experience of homelessness, and the New Mexico Children, Youth, and Families Department, or CYFD, who was also the funder of these endeavors. Yeah, I'll jump right on in. So first, I just want to give you a brief kind of overview of the geographic scope of the work that I'm talking about. In 2021, we were funded to conduct a needs assessment focused on Bernalillo County. So on the map here, that's the blue county with the number 3 on it. That space covers over 1,100 square miles, and it's home to over 670,000 residents. It's also where Albuquerque is located, the state's largest city, which in itself makes up more than 1/4 of the state's entire population, just in that one city. In 2023, we were asked to do another assessment, this time focused on CYFD regions 4 and 5. And those regions are the orange and the pink counties here on the map. So you can see it's a huge difference. This is 17 counties in the southern, eastern, south central, and southwestern part of the state. And while the geographic size of the area we needed to cover is much larger, the population is basically the same as Bernalillo County. Yeah, so very, very different kind of geographic areas, very different challenges. For regions 4 and 5, those counties are mostly rural and frontier areas. Some of them have concentrated areas of urbanization, but they're relatively smaller. So Doña Ana County down here in the bottom has the state's second largest city, Las Cruces, where I'm located. But even though it's the second largest city in the state, we're still only a little bit more than 100,000 people. So that gives you an idea of kind of the rurality of this part of the state. So while these were two separate projects, they had some components in common. The first 3 on the screen here, the New Mexico Youth Count and Housing Survey, some qualitative work with youth experiencing housing instability or homelessness, and some qualitative work with community-based organization personnel that work with these young people. Both the Bernalillo County assessment and the one focused on regions 4 and 5 had all 3 of those components. And then primarily due to funding constraints and staffing and time, the Bernalillo County had a much larger budget. We were able to do a survey, organizational assessment survey, and organizational workforce assessments with the service systems in Bernalillo County. So organization system leaders administrators, frontline workers, all working with youth between the ages of 15 and 25 that are experiencing homelessness or housing insecurity. As I move through the presentation, I'll touch on the survey primarily, highlighting some of the findings from the Bernalillo County assessment, and then move into regions 4 and 5. And then from there, I'll talk more about kind of the cross-cutting themes from both assessments regarding reasons why young folks reported housing instability, their other experiences, what makes it hard for them to access services, and their ideal living situations. And then I'll end with some considerations drawn from those projects regarding future systems level responses to the issues of youth housing insecurity. So first up, the New Mexico Youth Count and Housing Survey. So the purpose of this count and survey was kind of twofold. The first was that we were going to be estimating the number of youth and young adults ages 15 to 25 that were experiencing housing instability and homelessness in Bernalillo County and in CYFD regions 4 and 5. The second was that the brief survey would collect information to help us assess their characteristics and unmet service needs and housing needs. And we used a strategy called mark and recapture. It's a strategy to estimate the size of a natural population. It's drawn from like ecology, where you're trying to estimate populations of uncountable populations of uncountable things like birds or insects, but we can also apply this to humans, as weird as it is to say. But so you attach a unique identifier or a mark to individuals in a population at specific sites where they're most likely to be found. And then you return to those sites to determine how many of the same individuals are recaptured. And then the ratio of the marked to unmarked individuals in the population helps to arrive at a more robust estimate of its size. And this is in contrast to things like the point in time count, where you go out once and count folks, and then that gives you an estimate. This is a much more robust, accurate, potentially accurate way of estimating population. But so our use of this approach entailed 3 count periods. We separated each count period by 3 weeks, returning to the same sites at the same time during each period. For Bernalillo County, we spread out in that one county to create some coverage over sites. For regions 4 and 5, I'll talk about the problems there of trying to cover 17 counties at once. But so the way that we picked these locations was through meeting with young folks, guidance from our Youth Advisory Council, working with street outreach workers to figure out where the best places would be for us to go and do this count and survey. We also did some reconnaissance of actually just going to those locations that were recommended and seeing whether or not there were people there. A lot of them included organizations that provided services. So things like homeless shelters, food banks, places like that. But then we also had locations like parks, convenience stores, smoke shops, actual like street corners. And the process was that we would send a team there. They would do a visual count how many people within that age range are in the space, and then approach and offer a survey. Ooh, sorry, that just got out of hand. So for Bernalillo County, this process estimated that there was between 1,088 to 2,314 young people just in that one county between the ages of 15 and 25 that were without stable housing. Sorry, computer's making the noises. This is a conservative estimate given that we could not saturate all potential sites because this was in 2021. So we had to deal with pandemic conditions. There were also other factors during the count period, including safety considerations such as active shootings happening at a couple of count locations, increased police presence in some areas that ended up decreasing foot traffic. And then just in general, this is a hard population to find. Demographically, respondents experiencing homelessness resembled those that were stably housed, with a few exceptions. Respondents experiencing housing problems in Bernalillo County were slightly older than those that were stably housed and more likely to be over the age of 18. A higher proportion of those respondents identified as American Indian as well. Almost a third of the entire sample identified as sexual minority youth or gender minority youth. And gender minority youth approached 11%, suggesting that any kind of systems response to addressing the issue of youth homelessness needs to also take into consideration that a large number of them are LGBTQ+. We defined young people as those who stayed in their own home most nights during the past 30 days and stayed in their own home last night and who said they could stay there for the next month as stably housed. The rest of the folks were considered unstably housed. So based on that definition, just a quarter of our respondents were considered stably housed. And again, this is Bernalillo County specifically. The remaining about 75% were unstably housed or homeless, largely sleeping outside, couch surfing, staying temporarily in an apartment, house, trailer, mobile home, staying in shelters, transitional living programs, or residential treatment facilities or hotels or motels. Among respondents experiencing homelessness, a much higher percentage have reportedly left home for good than those who were stably housed. This difference was pronounced among those under 18 years of age. Half of unstably housed and homeless underage youth indicated that they had left home for good. Those experiencing homelessness were also far more likely to have been in foster care, involved with the juvenile justice system, or to have spent the night in an adult jail. They were also more likely to be pregnant or a parent. And then more than a quarter of respondents experiencing homelessness described their overall health as poor or fair, compared to 8.8% of the stably housed. They also reported going to a hospital emergency room 3 or more times over the past year, compared to just 12.2% of stably housed. In addition, they were more likely to say that their mental health was not good most of the time or always during the past 30 days. And our qualitative interviews with young folks helped contextualize these results, with most of the interviewees disclosing that they currently struggled with a serious mental illness. And those mental illnesses included things like depression, bipolar disorder, anxiety disorders. A small subset discussed having a psychotic disorder, and a few of them had multiple experiences with psychiatric hospitalization. Comorbidities related to substance use were also really common among the youth that we interviewed. So, moving to CYFD regions 4 and 5. The MARC recapture method didn't work quite as well. It estimated that there was 151 to 387 young people in those 17 counties that were currently experiencing housing instability. This is compared to Bernalillo County itself, which had between 1 and 2,000 estimated from this method. There's a couple issues here, right? So sites didn't necessarily represent all locations where TAYH stands for transition age youth experiencing homelessness. May have been across the southern and eastern parts of the state. Other estimates, things like the New Mexico Youth Risk and Resiliency Survey, place this population closer to 1,200 in just those 17 counties. But they use a slightly different definition of homelessness. They use just past 30 days, not if they could stay there for the next 30 days. So we have very different estimations. This gives you a better idea of the scale of the geographic scope of this assessment. Each of these little pins is a place where we sent a team to do the mark recapture method versus primarily this little area here. So like I mentioned, our efforts in this area were focused on several larger urbanized areas and specific locations in rural areas, which really limits our ability to estimate the population. The dispersed nature of the communities in those regions really don't offer, didn't allow for sufficient focused reconnaissance. It was much harder to get out to smaller towns and colonias and be able to spend enough time there where we're able to identify places where folks would be hanging out. There were also spaces that we just couldn't access, like state and national forests, where youth reportedly socialized or used substances. And that's because we simply just did not have the budget, staffing, and there were safety issues involved with getting into those spaces. We didn't want to send our staff into places where they might be unsafe. The other part of this were constraints on local knowledge. So most of the young folks living or that we encountered in regions 4 and 5 through our organizational connections. So folks that were currently working or currently staying in homeless shelters were from towns other than where they currently were located. So kids in these regions get moved around a lot. They also often get moved to Albuquerque. So the location of the first assessment that I talked about. So a lot of the folks that we had access to identify hotspot locations or places where we were going to be doing these mark recapture surveys really did not know the communities that they were living in. And so they weren't able to offer really solid suggestions. And the same for staff. A lot of the organizations in these areas don't have street outreach because they're in these really rural frontier areas. And so they were unaware of these hotspot locations to recommend for surveys. Still, we were able to gather some data. A little less than 20% of our sample were unstably housed or currently experiencing homelessness. Very few of them were unsheltered, staying in an emergency or temporary shelter. So staying in places that we considered just not stable housing at all. Most of the youth that we talked to had stayed the last night and most of the nights during the past 30 days in homes, be that of their parents or relatives, friends, or strangers. But they were in a situation that was temporary. So very few were actually out in homeless shelters, living on the street, those types of things. They were doubled up, couch surfing, living with other people. Some other significant differences here. So demographically, they were very similar to the youth that we surveyed in Bernalillo County. However, a smaller portion of the sample identified as LGBTQ or as American Indian or Alaska Native. This is probably because a lot of those youth get moved to Albuquerque. There are maybe 1 or 2 resources that are tailored to the needs of LGBTQ plus youth in these areas. And those are usually the only ones that are very openly affirmative of those identities. And so the youth that identify within the LGBTQ umbrella tend to get moved to places like Albuquerque where there are other resources there that are specialized for working with this population or are outwardly affirming. Let me see here. In terms of mobility and movement, all participants that were interviewed in regions 4 and 5, all of their homes were in towns other than where they currently lived. None of them were from the town that they were currently placed in. Almost all had experienced multiple foster and shelter placements, justice system involvement, experiences in residential treatment facilities. They had all experienced movement related to running away, I had one young person that was 16 years old that I interviewed, and he had lived in 15 different foster placements all over the state. So that's just kind of typical for this population. The movement of participants around the state from one shelter or housing resource to another meant that most were really isolated from their natural support systems. Basically, every young person that was interviewed had mentioned that when they knew that they were being put into CYFD custody or they were leaving home, they knew that they were going to lose connection with family and friends, godparents, siblings, all kinds of stuff. And that just made the conditions of being in a homeless shelter or in a foster family even worse. Like I mentioned before, in these areas, services were few and far between. Almost every participant that we spoke with described a lack of resources or housing in their communities. And then the last point here, most of the organizations, compared to Bernalillo County, most of the organizations serving this population in regions 4 and 5 were tied to religious organizations. While on the one hand, they can be really great resources and provide lots of support for young folks, many of those services were tied to requirements like attending Bible study or, as youth identified, converting. And a lot of the youth that identified as LGBTQ didn't want to access those resources because they did tend to have more conservative views around sexual orientation and gender identity. So across both of these, the young folks that we talked to provided multiple explanations for becoming unstably housed or homeless. Many young people described first experiencing insecure housing during their childhood, noting that they and their families would often move from place to place to find a stable place to stay. Often young people described leaving a home situation because their primary caretaker abused drugs or alcohol, or even because of their own substance use behavior, that they'd become pregnant or having gotten someone else pregnant. There was crowding at home. They'd come of age and felt the need or the pressure to strike out on their own, or they got kicked out because they were of age. Many of them talked about breakups, bad roommate situations, money problems, having a record of incarceration and eviction, or both, making it really difficult for them to find housing. And in most cases, more than one of these factors contributed to a youth's housing instability. A key finding across the various surveys and interviews with young folks, frontline providers, agency administrators, and system level stakeholders was the lack of awareness and understanding of what is happening in the lives of young folks who experience homelessness, and the incredible challenges that they face in simply trying to survive day to day. In our qualitative data collection with both young folks and professional stakeholders, the triangulated findings underscore that youth struggling with housing issues represent a largely invisible population that is diverse in composition, with disproportionate representation of BIPOC youth, Black, Indigenous, people of color youth. And LGBTQ youth. Complicated family dynamics and system harm, particularly poverty, racism, transphobia and homophobia, and inequities in education and employment shaped trajectories of homelessness among young people. Involvement in the child welfare system, including foster care and juvenile justice, is not unusual among young people who are housing insecure and have unique and unaddressed needs related to development or maturation, social support, and behavioral health. Discussions with young folks and their providers made it really clear that young people dealing with homelessness are being placed at risk for violent victimization, crime, being trafficked, or becoming homeless as adults. Some participants suggested that the longer youth remained unsheltered, the more likely they become socialized into homelessness, learning how to survive from others that they encounter on the streets. And one provider argued that the earlier someone experiences homelessness, the more difficult it is for them to come out of it. Our interviewees, both young folks and professional stakeholders, described the many trade-offs, double binds, or forced compromises that young folks who are precariously housed or unsheltered faced daily. These included participating in the illicit economy to make money to buy the basics or to pay for substance use behavior, engaging in sexual activity for a place to sleep, with one participant referring to couch hopping or surfing as a business transaction, stating that you just can't live somewhere for free. Our interviewees also described getting arrested to score a meal or have a place to sleep. And conversely, staying away from getting health and social services because they're quote unquote on the run. They feared getting arrested, or if they were undocumented, they were worried about those dynamics as well. So getting deported or denied citizenship or residency. The interviewees over the age of 18 described avoiding adult shelters, which were deemed by young folks and professional stakeholders alike as being extremely unsafe. In both the surveys and interviews, several young people noted that they did not seek assistance from shelters because of the presence of bias against BIPOC or LGBTQ plus youth, and because the rules prohibited them from having things like pets or cell phones. From the interviews, we learned that several factors undermine the ability of young people to get assistance to address housing and other support needs. At the individual level, these include not knowing about resources in their communities, not knowing how to access them, wanting to be self-reliant, fear of being judged, being overwhelmed by behavioral health struggles, or being distrustful of available resources. As already noted, being undocumented or having open arrest warrants also led young folks to stay away from services. Legal, bureaucratic, and structural barriers reduce their ability to tap into local resources. And here, young people characterized parental consent laws as presenting challenges for unemancipated minors who needed consent from parents or legal guardians to get housing or shelter services, medical care, or other supports, which simply doesn't make any sense. Other challenges included understanding and filling out forms and providing required documentation. A lot of places required state IDs, driver's licenses, or social security cards, things that folks just didn't have access to. Young people valued the assistance that they received from street outreach teams, youth service drop-in centers, and transitional living programs for connecting them to supports. But outside of major urban areas, those things simply didn't exist. But such support is instrumental in helping them overcome a lot of these bureaucratic barriers, including paperwork. Young people repeatedly reported not having enough support in their communities, especially if folks that they trusted in organizational settings moved on to other jobs. So if their caseworker that they really liked left, or if the navigator at a local organization moved to a new organization, that really disconnected them from services. Whether or not people were under or over the age of 18, wait lists are a major impediment to getting help for behavioral health conditions. Wait lists are super long. They can be several months. And if a person is in crisis or in need of immediate care, waiting 6 months is simply not an option. Transitioning from emergency shelters to transitional living programs and permanent housing also had considerable wait lists. So if you're leaving a shelter, you need a place to go. You can't necessarily wait another year or two to find another place. Finally, stigmatization and discrimination based on race, gender, sexuality, behavioral health, felon status were common in the lives of the young people that we interviewed. And it really shaped their interactions both within the community and within the broader service system. Young people described being burdened by mistakes that made it hard for them to get help, let alone simply get by. Mistakes included things like getting into financial problems or being evicted. Many associated their mistakes with their own substance use behavior and subsequent troubles that they may have had with the law. If they'd been in jail or prison, they experienced discrimination by potential employers and landlords. With one interviewee describing how no one wants to give him a chance with a job or with housing because of his status. Another young person talked about how being addicted is part of the job description of being homeless. This participant, who claimed to have a statewide record for the most placements in local psychiatric inpatient hospitals, described being kicked out of service programs because of his substance use. Several frontline providers and agency administrators raised concerns about young folks getting kicked out of programs and then turned back to the streets because of policy violations related to substance use. One administrator observed that young people need a place where they can make mistakes and get back up and be forgiven and continue going forward, rather than losing out entirely on services and support. Of note, the primary need identified by youth in both surveys and the interviews is housing, with the majority wanting stable housing situations in a small house or apartment with coordinated services and supports. This is one of the questions that we asked in the interviews and in the surveys. What kind of housing would you like? So the coordinated services and supports were things like support for improving their basic life skills, case management, addressing behavioral health needs. Some wanted to live alone, including remaining with their children or with significant others and friends. Safety and independence are keys to their ideal living situations. Many interviewees simply wanted a place to live as long as it wasn't on the streets and provided them with some sort of privacy. However, having lived in having lived previously in pejoratively designated war zones, particularly in the Bernalillo County area, others clearly wanted to live in places with less apparent risk of drug use, theft, and violence. Descriptions of independence shared by the young folks largely centered on being sober, having reliable transportation to pursue education and employment, and making enough money to pay for living expenses. Several also wanted to keep their pets, and most simply wanted to grow as individuals with the support of family, friends, and services as needed. Intersecting systems of social injustice create a confluence of unique harms for the young people we surveyed and interviewed, and shape their daily struggles for survival, safety, and independence, and contribute to the adverse health and mental health outcomes described previously. A minority of youth were unable to articulate what the next months, let alone years, might entail for them. Despite their ubiquitously traumatic struggles, most of the young people we talked to have the hope and the capacity to imagine and enact futures in which they're connected to the community and can fulfill basic aspirations toward education, employment, and overall well-being. Yet the structures and structural processes that condition the opportunities and life prospects of young people who experience precarious housing are often treated as fixed and immutable features of the social, political, and economic landscape. Here we have a social imperative to flip the script. So and our larger needs assessments, which I can provide links for in the chat. We document the deficits of the current systemic responses to youth homelessness, some of which I've touched on today. I want to make a few points about the response. So rather than being conceptualized as a community responsibility, the systemic response is not only mired in complicated bureaucracy, but it places the burden on individual level intervention and personal action and responsibility, despite overwhelming evidence that such responses are wholly inadequate to stem the growing numbers of young people impacted by homelessness in our state. Moreover, the current systematic response disregards important knowledge about brain development. Brain development continues into the early to mid-20s. And during this time, teens and young adults are building their identities and establishing values and goals that will affect their adult lives. Their brains are also responding to traumatic stimuli in ways that can affect their futures. This is when they benefit from safe spaces to make autonomous choices, cultivate and practice life skills, and receive judgment-free support in the face of so-called mistakes that thwart access to essential services and supports. Especially for young people ages 18 and over, safe spaces are elusive, as policies, rules, and service orientations governing existing programs emphasize individual choice and personal agency, with poor decision-making as an off-cited reason to deny them critical and sustained assistance. The current response also minimizes the root causes and consequences of being homeless for young people, abets their invisibility and neglect, and allows their unmet needs to worsen. Our team has made some calls to New Mexico for a fundamental re-envisioning of system responses, one that is foreground in a shared responsibility and practices of structural competency that tackle upstream factors, or the very structures of inequality that dehumanize youth and render them vulnerable to harm, thus making it possible for youth in this country to fully realize their aspirations for the future. If our time permits, I'd really love your reflections on what a response that emphasizes structural competency and shared responsibility might look like, and how we can make that happen. Thank you all so much. I'll open it up for questions. I know I moved very fast through a lot of information.
Thank you so much, Dr. Shattuck. That was excellent. And yes, people, everyone, please chime in with questions, and then also react to Dr. Shattuck's query to us about what structures could look like. And I should add, Dr. Shattuck, we're at the very early phases in our academic health department of looking at the houselessness issue in our community, which is rapidly growing. The other thing I wanted to say is thanks to Dr. Quintero for making this connection. It's rather fortuitous. Questions, reactions?
Hi, I'll ask a question. Hi, Daniel. It's good to see you again, and thanks for your talk. The more I learn about y'all's work, the more amazing I find it. Y'all really did a lot, just in terms of your methodology and really digging into these issues. I guess I was wondering, if you had, I'm thinking about the AIAN population. I was wondering, did y'all have any data like breaking that down by tribal affiliation or anything like that?
That's a good question. I don't believe that we do, because the survey itself was like 10 minutes, 5 minutes, if that. And so we didn't break that down in that way.
Yeah. No, I think it would be interesting, because there are some important differences related to that in that area that I recall. And then as far as, as you concluded, you were talking about, maybe a different sort of model that looked more at shared responsibilities and those sorts of those sorts of philosophies and ways to move forward. And I guess I would suggest as you all move along, you might want to take a look at the global health literature. Um, and because I think there's more models out there in that domain where you do see much more emphasis on kind of like community development, social development around various sorts of health issues, and kind of mobilizing communities in a way that might help you work towards getting away from this emphasis on personal action and individual responsibility, and kind of coming up with a different sort of model or emphasis.
A great suggestion.
Others?
Yeah, this is Damien, and I just had a quick question. And sorry, folks may have noticed I was on video and I'm not, because I'm driving to an in-person meeting, because this day and age we have online and in-person meetings mingling. But my question, and you might have shown this when I was transferring from my office to my car, but have you done any exploration of youth involvement in the foster system, and whether, there's this argument that, especially with American Indian youth, that, removing them and putting them in the foster system creates this positive platform for adulthood, when the evidence in Montana doesn't really show that. It shows that youth who've been involved in the foster system are usually more likely to suffer, adverse outcomes and experiences. I was curious, did you guys get to look at that at all?
Yeah, so a large portion of our sample was involved in the foster care system, and across the board, they had worse outcomes than youth that were not. And part of that is because of our system here in New Mexico shuffles young people around. They get placed into places that have not been vetted properly. We also have a much larger demand for foster care than there is placements available. So unfortunately, if you've seen the news in New Mexico at all around foster care or CYFD, there are kids living in CYFD offices, like staying overnight in office buildings because there's not a place to put them. So there's a lot of structural issues for our system that perpetuates these negative outcomes for foster involved youth. But we haven't broken it down specifically by race, but I imagine that if it holds for the whole population, it's probably true for our American Indian young people as well.
Dr. Shattuck, that makes me think about the Indian Child Welfare Act, and probably something that, you weren't able to dive into in this short survey, but yeah, I guess that's very aspirational, but it's also a mandatory element of foster care that's just not followed most of the time.
Yeah. Yeah, there's a lot of aspirations for the system that just don't become a reality.
Other
And
questions?
sorry, this is Damien again. And Jim, I can't see if other people want to ask questions, tell me to shut up. But
I will.
I was just curious, Daniel, as you all were doing this work, did you have an opportunity to do any sort of exploration or compare and contrast between New Mexico and other states? And specifically, have you seen things happening in other states that systematically reduce the incidence of housing insecurity for youth? Just curious.
That's kind of the next phase of this. I mean, I'm not a statistician by any stretch of the imagination, but I'm working with our quantitative team to do some more comparisons between New Mexico and other states.
Piggybacking on that, is the Medicaid reimbursement, would you say it's restrictive or broader than other states, or maybe you don't know? I'm just thinking that, I know the state of Oregon has done some pretty radical things in looking at like what Medicaid can pay for at this, so.
I know that we're currently trying to become a little bit more creative with how that works in the state, trying to be a little bit more progressive around it. I know schools are making headway on being able to work with Medicaid to provide other services. I'm not too sure about this particular service sector.
Sure. Anyone else?
Yeah, this is VRAD. I'm also in a car driving right now, so my camera's on. I'm just curious, when you're designing the study, we're designing, as Jim mentioned, we're doing something similar, looking at the unhoused population in Missoula. And one of the work groups is looking at the specifically looking at the lived experience. And when we're designing, like looking at our research methods and stuff, one of the things that we're pausing to do is like theoretical orientation that design like informs the methods and the methodologies. And I'm just wondering, when you engaged in this, what role, if any, did theoretical orientation play?
Yeah, so these needs assessments are based off of a framework from implementation science, because the goal was really to set up the foundation for some sort of intervention down the road. And so we use the exploration, preparation, implementation, and sustainment framework from Greg Ahrens and his team out of University of California, San Diego. And so that framework really walks you through, okay, during exploration phase, here are the things you need to explore, at multiple levels, system level, organizational level, end user level. And you gather that data in preparation to start the work of actually doing an intervention. So it tries to get data that's going to be fairly usable rather than just interesting intellectual projects.
Thank you.
Yeah. One thing that I found really helpful for, it's not necessarily a theoretical orientation, but just a method within or a strategy within the interviews, was that we would sit down with young folks, and after, a little bit of time to build rapport, the first task of the interview was to create a timeline of their life. And so we would go through year by year, basically, with each young person and get them to write down all the major kind of milestones. So that's where we would be able to map out how people moved through the system, like how many placements they had, when they went to a residential treatment facility, when they left the state, when they moved from town to town. And that really gave us a really, really clear picture of the types of experiences young folks had had.
Dr. Shattuck, we've done a similar thing in my research lab. Dr. Goldstein Cole has done work, but with incarcerated men. So later in life, but a process called life graphs, looking at adverse childhood experiences and identifying particular points where the men felt that there were missed opportunities, where things really could have been different. So I know that my colleague would be happy to share that. So yeah, and we back and forth. That'd be great.
Yeah.
Very practical question. So we're as BRAD said, in designing this study, the very beginning phases, we're envisioning kind of a two-tiered approach, where it looks like you did too, where you actually talk to those that are unhoused, and then those that maybe are providing services and things like that. Obviously, the IRB processes are much easier talking to those that are doing the work. So can you say anything? I know there's probably a lot, but just briefly about the IRB process and how that went for you in getting approval to work with this vulnerable population.
Yeah, so we had to prove that well, first of all, we had to show that our team was really trained to be working with these groups. So we had extensive training for the survey teams. They also were around the same age as the youth that we were surveying. So that it helped kind of equalize a little bit of the power dynamic that the IRB would have been worried about. We had professional resources available. So we had social workers, we had counselors, those types of folks available for consultation in case there were any kind of emergent issues when we were talking with young folks. We also had resource sheets of places that they could go to get help with food, clothing, behavioral health, housing, all kinds of stuff. So we were making sure that we were covered in case there was a need there that needed to be addressed immediately. Most teams had at least a few people that were QPR trained. So in case we're dealing with emergent kind of suicidal ideation, they knew how to kind of handle that situation then in the moment. We also didn't collect any identifying information. So we didn't have a way of contacting these young folks. It was the one time only. We did have a unique identifier that they came up with themselves that helped us track across. But there's no way that we would have been able to find them again if they didn't approach us in those survey sites. We also asked for a waiver of informed consent because they were going to be sharing information with us that could put them at risk. So if they admitted things like substance use, dealing, sex work, those types of things, it would have put them at risk. So we asked to not have to have them sign anything and further put themselves into risk by participating with us. I can share probably, if you email me, I can probably share our IRB documents and things.
Oh, that would be amazing. And at Pyre, did you use one of your university partners' IRBs or a private IRB or?
It went through at Pyre. We have our own IRB.
Okay, great.
Yeah.
Thank you so much.
Yeah.
Any other questions? Okay, well, really want to say thank you, Dr. Shattuck. Again, this is really, really great presentation. So timely for us, and we will be emailing you. Absolutely. So,
thank you all.
Anything that we can do, you know, to reciprocally help out your project, you know, I think we'll probably see some similarities that are going on in our rural communities as well. So,
Guarantee it. Yeah. Thank you all so much.
All right. Thank you, everybody. Take care.
Thanks.